Hi, how are you doing? It is Tuesday, October 3rd. It's about 5 p.m. I'm Delaware State Representative Paul Baumbach, serving the 23rd House District, which represents much of Newark on the west and the north side and beyond. I also serve as the co-vice chair of the Retiree Health Benefits Advisory Subcommittee. It's a big mouthful. And I provide these regular updates on Facebook and YouTube on the ongoing discussions and decision making regarding retiree health benefits for retired state employees. Won't go through. I think most of you already know what this is all about. I've got past videos if you want to learn more. So I'd like to report on yesterday's meeting of the State Employee Benefits Committee. It was considered a special meeting whereby its agenda was pretty focused, a call to order, brief report from the director, not much from the subcommittees, and then there was an opportunity for the Retiree Healthcare Benefits Advisory Subcommittee to share their findings and recommendations. And I was joined. That presentation was led by the RHBAS chair, Lieutenant Governor Bethany Hall Long, and I, as the co-vice chair, was also given the opportunity to assist in that presentation. We had some questions from SEBC committee members. At that point, we went to the next item, which was reviewing the final draft. When I say we, I mean the SEBC, because no one else saw the final draft, only the committee members themselves. And there was discussion. There was no vote on it. I'll get to that in a minute. Other business, I don't think there was any. Public comment, there was a bit. I can talk about that also. So that was what we were there for. I will say, so let's do our report. So we had a two-page, the RHBAS had a two-page final abbreviated report. It was final because there were probably 4 versions going on at one point or the other. It was abbreviated because it was narrowed down just to relate to the RFP, as you see in the first paragraph. This is to formally inform the SEBC of work and recommendations that relate in particular to the RFP that the SEBC was taking under consideration yesterday. So it jumped down to the bottom of the first page. There were 5 motions that were shared and presented. The Lieutenant Governor, the chair of the RHBAS, presented 1, 2, and 5, and I did 3 and 4. So the first one came from, it was initiated by Wayne Emsley, RHBAS member Wayne Emsley, on, I believe it was August 10th. And what it noted is that you should not change, the recommendation is no changes are made to anyone who retires prior to 2025. And you keep the same kind of benefits, the same Medicare kind of program for them. No changes to what percent of the premiums they pay. And importantly, on the second line is the term entitled. So this was under discussion in the RHBAS. And what it says is that these retirees are, gosh, can I say grandfathered? Regardless, let's use the actual words. They are entitled to the same benefits they have been receiving. It's a supplement to Medicare. The traditional Medicare would continue to be the base for them, and then a supplement provided by the state, and it's essentially identical to, and they're entitled to that supplement from the state that is, in essence, identical to the current Medicare system. That was the first one. 3 weeks later, on or about August 27th, the last 3 motions were passed. The first says that in this RFP, Delaware should neither request nor consider any Medicare Advantage plan. Back when these were drafted, this was fairly contentious. Since then, the SEBC and the administration have seen the light and come around to not putting Medicare Advantage into the RFP to the best of our knowledge. We'll talk about that in a minute. But the RHBAS had a formal motion in favor of that. All these motions passed with at least 60% of the members of the RHBAS in support. The third and the fourth, the ones I presented, I want to point out that each of these passed with 80% support. These were all 12 to 3 votes, and the only people who voted against it were the 3 cabinet secretaries who report directly to the governor. So number 3 said, so this RFP, it's kind of important, and we think therefore it should be shared with the public in advance. We think that the public should have the opportunity to speak to the SCBC before the SCBC votes on it, and darn it, the SCBC should vote on it. None of that was done. The SCBC pretty much rejected that entire recommendation. And some of the reasons that were shared were weak, to say the least. My favorite is that this would be unprecedented. That was the word used multiple times. Specifically, the Deputy Attorney General, that's the lawyer assigned to the SCBC to give them guidance on what's legal and what's not legal, noted that there's nothing illegal to do this. The comment was, it's unprecedented for a state agency to do this. And that you have to qualify it because, for instance, the city of Newark has done that twice in the past decade. When they were doing RFPs, they drafted their RFPs, particularly these 2 particular RFPs, in public meetings. And the reason why it's legal is that the concern has been raised frustratingly by some of the cabinet secretaries is that, this could be viewed as giving an advantage to one of the vendors. Well, that's crap. Because when you share it publicly, it's available to everyone equally. That's the whole point of transparency. That's the whole point of sharing it publicly. Regardless, this was not done. The SCBC voted upon it without hearing from the public first. They voted upon it without sharing it beforehand. They voted upon it without sharing it at the time of the meeting, and they still have not shared it. So they pretty much took that 3rd recommendation and put it through the garbage disposal. And then the 4th one is that the RHBAS, with 80% support, approved the motion, said this next contract should be for 3 years. And there's one main reason for requesting 3 years. Well, first thing is the last one was done for a 3-year term with 2 optional 1-year extensions. It's been extended since then. Why? Because in an unprecedented way, the courts have shut down what the SCBC did last time in this regard. So that they forced the SCBC to extend that original contract longer and longer. But more importantly, it was done 3 years before with 2 optional 1-year extensions. To do this in 2 years, it means that the SCBC in less than 2 years will be finalizing the RFP to replace what they're going to be doing now. What's in 2 years? That sounds like that's going to be October 2025. What happens in January 2025? The next governor is inaugurated. The next governor begins building their cabinet. The next governor has their nominees for cabinet posts go before the Senate for their review and approval or rejection. So we're asking the Department of Human Resources, without knowing who the governor is going to be, without knowing who their choice for cabinet secretary for the Department of Human Resources, to be working on this RFP, which defines the medical support for our retirees, our Medicare age retirees, in well under 12 months, under 9 months. So that to me seems pretty important. But more importantly, our state retirees have been whipsawed, have been yanked left and right over the past 14, 15 months with the uncertainty. Oh, it's going to be this. It's going to be terrible. Oh, it's going to be this. Okay, that's great. Oh, no, maybe not. Oh, no. So we have had such uncertainty, and we've been whipsawing our retirees for well over a year. And this says, you know what? Let's give you 3 years actually being able to sleep at night. Well, no. The SCBC was silent on that also. And then the last motion was that no changes should be made except for people who are not hired yet. So people who are hired by the state after 2024, starting January 1st, 2025, when they're hired, as they're being hired, they'll be told what changes, what their retiree health benefits are, and they could well be different than what current retirees and upcoming retirees who are already working for the state have. But they'll know when they agree to work for the state initially that they have a different set of changes and what those changes are. So there's no change in the game, moving the goalpost during the game. And the Lieutenant Governor, the chair of the RHBS, presented the fifth one. So that's what we presented. And then the one thing that was released late today, and it is on the website, is, and this got debated, I don't understand why, a release of what the statement of work is within the RFP. Of course, we have to take their word for it. This is from the RFP because they haven't released the RFP. But this reinforces what they have said for the past past month, which is proposals are requested for a Medicare supplement that's not Medicare Advantage. Okay, so they're looking for a Medicare supplement plan for current and future Medicare retirees. So it's not one where current retirees would get a Medicare supplement and future ones would get Medicare Advantage. During this contract for this plan that they're requesting proposals for, only a Medicare supplement for everyone who's an eligible retiree, and that the plan should duplicate the plan design and everything else that we currently have. For the quoted Medicare supplement plan, but it should duplicate the plan design, provider network, and administrative setup, including coordination of benefits. Right, duplicates the current Medicare supplement plan without deviation. We've been really conscious of wording, so we're looking for, essentially, we want Medic-Fill with prescription benefits, or the same thing under a different company's brand name. That was put out there, and then the rest is just numbers of how many people will be covered, and it would be effective for as of January 1st of 2025 and beyond. So that's what was released. I will say that the SCBC did adopt a motion earlier in the meeting and said the following. It's the SCBC's intention to solicit bids for medical third-party administration services for one self-funded employer-sponsored Medicare supplement plan, again, not Medicare Advantage, that duplicates the current plan design without deviation. All Medicare-eligible pensioners will have the same plan for the duration of the contract. Bids for any other arrangements are not being solicited and will not be considered by the SCBC. This is reinforcement that Medicare Advantage will not be considered by the SCBC and will not be part of the plan in place for 2025 and 2026, and possibly a one-year extension beyond that. So there's a lot of successes that happened yesterday. We did have very good questions from some of the independent members of the SCBC, and that was encouraging. But we did not have the SCBC or a majority of the members stand up and say, no, it should be a 3-year duration, or that no, we need to hear public comment before we discuss it, or for that matter, just to exercise the right to vote to approve the RFP, or to reject it, or to amend it. Again, there's a lot of good. In addition to those positive aspects, I want to point out that we were overloaded with the public in Dover yesterday. Close to 100 people were there, overflowed into another area. In addition, there were, I don't know, I believe somewhere in the well above 50 and maybe above 100 members, retirees who joined remotely. So bottom line is everything we know about from yesterday's meeting is no Medicare Advantage for 2025 or 2026, and certainly not until then. And that what is being requested is a Medicare supplement that is Medic-Fill without the name. If it's provided by any other company other than Highmark, it should have every look and feel of what the current Medic-Fill plan is, and still have the prescription drug benefit in the same way. So we'll chalk that up as a success. I say my expectations and standards are higher. I think I would have liked to see better, but we can still view that as a very beneficial outcome for Delaware state retirees, and we will keep on it. In addition, the next meeting has been set for the RHBAS. I think it's noon to 2 or noon to 3 on October 27th, if memory serves. I have to go through my calendar and see where we are. RHBAS 12 to 3 on the 26th, Thursday, the 26th. That's the next meeting in the RHBAS. We have a lot of work to go on that. But right now, SCBC, no Medicare Advantage. The plan should have, it should replicate without deviation the current MedicFill program, but obviously with perhaps a different trade name if it's a different provider. Thank you for tuning in. It could be maybe 3 weeks, even over that, before my next update, given that our next meeting is not until the 26th of October. Thank you very much. I hope you have a good week.